AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors of Brevard County. Our show is designed to help educate, inform, and connect seniors and those that care for seniors with resources. We started the program officially, started building it, in August of 2011, folks. We opened our first office a year ago, officially. Since then, we have handled over 600 calls where we've actually given help to the caller. Now, we've received many more calls than that, but we've actually helped over 600 callers. Listen for a second just about some of the things, and leave my comment on this during the show. We find a number of women that are in their 70s, 80s, and 90s that are living on very, very reduced incomes and food stamps, and they just can't pay bills. And they call us. And Kay, the information specialist, starts talking to them, finds out what the entire situation is, and she'll ask a question. Did your husband serve in World War II or Korea? And invariably, the answer is yes, which qualifies them for an additional $1,400 a month called the Veterans Aid and Assistance Pension to widows. They don't know about it. I've talked to some people about this, and they said, Joe, the veterans will take care of that. Like thunder they will. They won't take care of it unless somebody knows to ask them to take care of it. And that's why what we do at Helping Seniors is so different and so important. The County Housing and Human Services Office doesn't do this. 211 doesn't do this. Aging Matters doesn't do this. Nobody does it. That's the problem, folks. It's not that these resources are not there. They are there. But the whole reason for Helping Seniors exist is because of our radio show, our television shows, our newspaper articles in Senior Scene, Spotlight, Adia Today, Ebony News, and Hometown News. What we do is try to provide the information and education so that you, the potential users of services, know where to go. I can't begin to tell you, folks, how many people that are educated, smart, business people call us simply because they don't understand the care equation. They don't understand what it means to have a need for services and not know where to go to get the services. So many people overpay. So many people fail to get the help they need because they don't understand how to go about getting it. That's why Helping Seniors exists. So, if you've got a question or call Kay, our information specialist, at 473-7770, 473-7770. And we've moved our offices. We sort of became, you better like a better word, non-welcome where we were. So we're looking for new spaces. And if any of you are realtors out there, if you've got a good, decent office where you want to help a good organization locate, give Kay a call at 473-7770, and we're sure to listen to it. But my sponsors for this part of the show include Gentiva Home Health Care, the Eye Institute, Solibite Dental Implants, my panelist today, Dr. Lee Sheldon, Bill Johnson, elder law attorney, radio station WMEL AM 1060, Wusthof Hospital Systems, Levin Home Care, Atlantic Shores Rehab, and Ebony News Today, and now Aldea Today, the Spanish newspaper, folks. That's right. We're in almost all the small newspapers in Brevard County. They're all putting our columns in there so we can reach out to all of you. So today we're going to talk about the denture show.
Is that what we're going to talk about today?
We're going to talk about dentures, but we're going to talk about some other touchy matters, I call them. Lee sent me some things that we want to talk about, but I got some things I wrote down which I call touchy areas.
I'm not prepared for any touchy areas today, Joe. Unless I know what the script is, I don't think I can handle it.
You've never followed a script in 10 years. So, no, that's not true. You have followed a script.
You haven't followed the script.
I haven't followed a script. But one of the reasons, Lee, I had a guy send me an email the other day, and he said, Joe, who listens to talk radio anymore? Who listens to AM? And I sent the guy an email back, and I said, well, if you listen to it every week and listen to my radio show, I said there'd be one more person listening.
That's right.
So, what good would it be to have a television show if people didn't watch it? Why would we have radio if people don't listen to it? Why do we have newspapers if people don't read them? Why?
Because people do read them. There is a value to every type of media there is. I'm going to go to something because I'm very much into marketing and advertising and teaching other dentists how to do what we do as far as marketing and advertising. There is the old rumor that the Yellow Pages is dead. Well, for marketers, for advertisers, well, who are the people who are actually using the Yellow Pages? Those are the people in the 60s, 70s, and 80s who aren't necessarily used to using the Internet, so they still go to the Yellow Pages. So if you're going to advertise, you might want to use the Yellow Pages, and you can get Yellow Pages at a bargain right now. People say that, it's got to be the Internet. Do you know that Internet advertising, well, of course Internet advertising is up, and we in our practice rely on Internet advertising a lot. Do you know what Google spends more and more money on each year?
What?
Direct mail advertising.
Direct mail?
Yes. So people say direct mail is dead. Listen, Google is what? One of the top companies in the world. They're using more direct mail. So understand that every media has a particular advantage, depending upon the listeners and the viewers and the readers who are going to take advantage of that particular media.
Lee, what I'm going to say next completely underscores what you're saying, because here in Brevard County, roughly, let's just say we have roughly 550,000 people,
yep.
545,000. If we go by the AARP standards, 55 and older, 254,000 of our citizens in Brevard County, Florida, qualify as a senior citizen.
It's almost half.
Half of the county. And we say, people don't read a newspaper. Maybe some of the young ones that fool around with the Facebook and the Twitter, maybe they don't read it. But you just pointed out a whole slew of people that do read the paper.
That's right.
And they do rely on what they see with their eyes to know where to go for help.
Yeah.
I was talking. I went up to Flagler yesterday to pick up some art for the art auction next week over at Holy Name of Jesus Catholic Church. And one of the artists that donated is a fellow that has been giving to us, helping us for 15 years. And he flew his airplane into the water at 72 miles an hour a couple of years ago. And you can imagine what it was like hitting the water at 72 miles an hour. Mm-hmm. It's like walking into a brick wall.
Yeah.
He lived through it. But it banged him up pretty bad, and he said there's two things that he fears. One of them had to do something with pain caused by something, and the other was going to a dentist. And that brought a smile to Lee's face, folks, because Lee has heard me talk about, over the years, I've always had a terrible, terrible fear of the dentist. I have often joked, and I've told all the dentists that have worked with me, I've said that dentists to me are the greatest inflictor of pain known to mankind. However, I have to couch that statement and say that when Dr. Sheldon did my dental implants, I never felt a thing. I don't even really admit to feeling the first stick in my gum, Lee, that you gave me to give me the shot so that I didn't feel any pain. And you did some extensive surgery on me that I didn't feel a thing.
Yeah.
And this is why it's so important. We can talk about dentures. We can talk about dental implants. We can talk about just plain old going to a dentist. And I'm sure there are people listening to you and me talk today that will say, what the heck is Joe talking about? I don't even want that dentist assistant to get in there with those probes down below my gums.
It's upsetting. It is upsetting because, of course, I face that kind of statement nearly every day. And it isn't that current dentistry is uncomfortable. It is very comfortable. But we tend to live through those experiences that we had as kids, and it was our profession that did that. Our profession who was too rough with kids. Our profession who decided that it's going to cost $5 extra for anesthetic. Do you want it? And mom said, well, I can't afford it. And so that patients had to go through, had to endure pain that they wouldn't have to do. Our profession, who at one time would give injections and give injections very, very fast, which becomes a painful injection. It is our profession that did that. But I can't do anything about what was done in the past. I can do something about what is being done right now. And so the 3 doctors in our office know how to give injections because I've taught them how to do that. One way, by the way, for you who are seeing dentists, you can actually, if you've had an uncomfortable injection, sometimes you can help the dentist make the injection more comfortable for you. And I'll tell you how we do it. I'll tell you exactly how we do it. And if you listen and you get it, and that's fine. And if you don't, just call us at 631-1300, and I'll be happy to answer the questions on the air. But there are 2 points of the injection that hurt. One is the initial stick. And the initial stick is blunted by using topical anesthetic, that jelly that's put on the gums. And you need to leave it on long enough for it to work. It needs to be on there for a good 2 minutes before it's really going to work. So we want to make sure that topical anesthetic is on there long enough to make a difference. The second thing that bothers you is the pressure of the injection. And the way we can get by the pressure of the injection is this. We do the initial stick, and this is exactly what I did on you, Joe. We do the initial stick after the topical anesthetic is placed, and we just put 1 drop of anesthetic, which takes about a second, and then we withdraw the needle. We let that 1 drop of anesthetic work, and when that 1 drop of anesthetic works, now we have a larger area that we can inject to that will be totally painless. Now we can inject in that area and give a little bit more fluid, which will then spread out the numbness even more. So that if we do this sequentially, we can give a painless injection because we're injecting into a small numb spot, making that numb spot bigger, and then to give the final injection, which will numb the tooth or numb the gum, then we can give that injection into a totally numb area, and you won't feel it. That's the reason you didn't feel the injection that you gave, and that's my son and Dr. Furtado give injections exactly the same way in order to make sure that you don't feel it. Now, the area that's the most sensitive part of the mouth happens to be the roof of the mouth. That's the most uncomfortable injection that people get. That injection can be given in exactly the same way as I stated. A small injection first, only for a second. We can all tolerate something for a second. And then allow that injection to work, and then inject through that numb spot, and you won't feel it. And that can be done every single time.
Here's a question.
Yeah.
A lot of people, maybe a lot, or use the word lot or many, but I'm sure there are people that know they haven't been to a dentist in a long time, and they know that when they go in, it's going to require some extensive work to clean their teeth.
Yep.
They know that.
Yep.
So they're afraid to go in. If a person has a real problem with deep cleaning, it is possible to give them a shot so they don't feel that. Can't you do that?
Yeah, there's a number of different ways. First of all, hygienists in Brevard County or hygienists in Florida, if they're trained, are now able to give injections. We were one of the last states in the nation to allow hygienists to give injections to get patients numb. Yeah, that only happened a couple of years ago. And so Rebecca and Sue in our office are both inject. And so you can be numb in order to be able to get get the deep cleaning done. And the deep cleaning done, of course, is the reason we're doing that is to prevent tooth loss. The reason we're doing a deep cleaning in the first place is because bacteria has gotten way below the gum line on the root surface. We got to get the root surface clean so the body doesn't reject a dirty root surface. So it's important.
You know, the field of dentistry, I go back, you made a comment about older people reading the yellow pages, and I think back when I was 6, 7, 8 years old, and I go to the dentist, back in those days, more of us went to the dentist to get a cavity filled, and I don't see the same thing happening today that happened 60, 70 years ago.
Well, it used to be that you would go to a clinic, you'd go from school to a clinic or after school to a clinic, and there was a free clinic to have dentistry done. That was what was done in at least large cities. I don't know about small cities. A lot of things have changed. First of all, people aren't getting nearly as many cavities now as they did when you were a kid, when I was a kid. That's changed.
But we only have cavities.
Why aren't we getting them? There are different reasons and different theories about that. And it could be as simple as this. At sometimes in a disease's life, we've got a lot of disease, and sometimes the disease just dissipates and we don't get any disease at all. And I tend to subscribe to that theory. The theory that most people will say is, well, everybody has fluoride now. It's not necessarily true. You know, we put fluoride in the water supply, but how many people drink water from the water supply? So, we drink filtered water, we drink bottled water. So fluoridation, there's a question as to what the benefit of that is. But the question has really hit a head right now because the Cochrane Review. And the Cochrane Review is and I think we talked about this on last month's show.
No.
Okay, we didn't. Okay. The Cochrane Review, essentially, the group called Cochrane is one who goes back and reviews the medical literature, looks at all of the studies in a particular topic, and reinterprets the data, reads the data, and forgets the conclusions that were drawn by the original authors, and instead looks at the data and at a new point in time comes to new conclusions. It shows what the whole body of data shows.
We're talking about all medical.
Anything, yeah. We can talk about Alzheimer's, we can talk about heart disease, we can talk about anything.
Okay.
Well, they happen to review fluoride. And what did they find with fluoride? They found that, and fluoride studies have been done since the 1940s.
Right.
And there are lots of studies on fluoride. They found that 97% of those fluoride studies were biased. 97% were biased. That means that when those studies were done, the people who were doing the studies already had a preconceived notion as to what the studies should show, and the data therefore showed that conclusion that the study authors were trying to purport. It means that the data on fluoride is essentially false now, and anything that you hear about fluoride, and I'm talking about fluoride in the water supply, anything you're hearing about fluoride in the water supply essentially is biased data. We've got to look further and see whether fluoride is really doing what people say it's doing, and likely it's not.
Well, just think for a minute, Lee, about the complete evolution of medicine. Over the years, you and I have done shows on the value of vitamins, the value or non-value, or the detrimental harms of sugar and salt.
Yep. And that's real. By the way, not salt, sugar. Salt studies are coming out showing the salt makes almost no difference, maybe no difference at all in blood pressure.
Is that right?
Yeah.
When do you start? Okay, let me ask you, what is your theory, or has your theory on Juice Plus changed?
There's no theory on Juice Plus. There's 31 studies in the medical literature that are not biased, that the reviewers or the people who are doing the experiments had no idea who was taking Juice Plus and who wasn't. It's totally unbiased data, and it's not theory. That is a fact. Juice Plus does work, and while this is not a commercial venture, because Juice Plus is a commercial product, Juice Plus is one company that's gone way beyond the pale to make sure there is unbiased literature to show that, in fact, it works.
Okay, all right. Let's just talk about Juice Plus.
All right, good. Am I allowed to talk about a product on the air?
Yes, you can talk about Juice Plus.
All right, good.
Because somebody's trying to get me to take Juice Plus, and
Ooh.
I want to know, I'll be 82.
Yeah.
Is it to my advantage to take that Juice Plus, the purple or to red and the green ones, which are harder than the other two? And I don't know if you realize that they're harder to chew.
Oh, you're talking about the chewies, the gummies.
Yeah, the gummies.
Oh, well, I've only taken the capsules. I've never. Well, I've tasted the gummies.
Those capsules are so big, I choked on them.
Well, let me give you some data on that right now.
I would like to know about Juice Plus.
All right, so what do you want to know about Juice Plus?
Are you too old to start taking it? Would it help? You know my medical condition.
Yeah, I do.
Do you honestly think that would help me if I really started a daily regimen of Juice Plus?
Well, let me ask you a question.
Okay.
Do you think it would help you to have a daily regimen of fish and vegetables?
Yeah, probably would.
Okay. Juice Plus is a food. It's not a drug. And so if we're taking food food for the taste, well, if all we had was hamburgers and French fries all the time, how would we feel? The fact is the body needs nutrition in order to work. It needs nutrition in order to be able to go through the different chemical reactions that occur in order to be able to make the body work optimally. Juice Plus is not going to make you live to the age of 300, but Juice Plus is going to help contribute to your well-being by making your body work better, and that's well proven in the literature.
So Juice Plus is sort of going to be sort of classified with the same connotation as vitamins?
Well, I think, first of all, the studies on vitamins are not very good. You know, there have been some studies on vitamins using isolated vitamins that show that people do worse with vitamins than if they did nothing at all. But if you take Juice Plus is a food, and there are studies to show, 31 studies that show, that in fact people do better with Juice Plus.
Well, I've gotten some indications from some people that I do know and do trust to say that all the studies show that Juice Plus really can't hurt you. It can only help you.
Good.
And I know that before my dental surgery, you put me on a Juice Plus milkshake thing for a month.
I do. I put patients on a lot of different supplements that over the years were shown in the literature to help people heal. You know, coenzyme Q10. If you have a deficiency of coenzyme Q10 in your body, you're not going to heal as well. Zinc. There are different things that we can use to determine that we can use in order to be able to make ourselves heal better. And why not do that before surgery?
Okay, we'll pick up on that after. We're going to take our mid-show break, folks. Stay with us. I still got 6 dental questions I want to go through, and I will get to those when we come back from the break. Be back. I'm Joe Steckler, founder and president of Helping Seniors of Brevard. Our mission is to provide seniors with resources and education so they may age with dignity. However, we need your help. Our first benefit auction is on October 17th at Holy Name of Jesus Catholic Church with an incredible collection of unique items. Please call our office at 321-473-7770 to learn how you may purchase tickets or find out more. That's 473-7770.
AM 1060 WMEL.
This is Joe Steckler, folks. We're back live with the second half of the show. Just a short commercial before I get into the second part of the show with Dr. Sheldon. I want to remind everybody that the sponsors help us put this show together, and my sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, the Fountains of Melbourne, Beth Courtney of the Braswell Courtney Financial Team, Canadian Meds of Melbourne, Wiedemann Malik, attorneys, Vitas Hospice, and Peaceful Beach Mediation by attorney Brooke Goldfarb, who instead of trying to help encourage seniors get a divorce, she tries to help seniors talk their problems out so they don't have to get a divorce.
Good, Brooke.
And that's exactly what more people need to be thinking about. But you know, right before I came on the air, you saw a radio station was playing a short commercial about our auction. It's going to be next Saturday night over to Holy Name of Jesus Catholic Church. It'll start at 6 p.m., folks. I want to tell you, you know that I've been doing these type of charity fundraisers for 25 years. But I will tell you honestly and from the bottom of my heart that we need your support for this auction next Saturday night. And if you come to the auction, you will see things that we've never been able to put together in this town before. One thing is a Super Bowl poster of Super Bowl 49 signed by the Navy Heisman Trophy winner who later went on to be a halfback for the Patriots, Joe Bellino. Joe took the posters to Coach Belichick over at the Patriot camp there in Massachusetts and said, Joe would like for you to sign these. And Coach Belichick said, I can't sign them, Joe, unless Joe tells me how he wants me to sign them. That's the honest-to-God truth, folks. So I sent an email to Joe Bellino, and I said, have him say, to help seniors in Brevard County, Florida. And it's exactly the way the poster's signed. And I walked into the Highland Mint yesterday, and they gave me a coin to use the coin to use for the flip toss. So Ridley's is putting that frame together for me, and we'll offer that at the auction. I've got one piece from Captain Bruce McCandless, who made the first untethered walk in space. He sent me, he's a classmate of mine from the Naval Academy, and he sent me a picture as he was making his first walk. How many of those things do you think exist, folks, today? But Bruce did that for me. And it also helped that Belichick signed the posters, because when I played football at the Naval Academy back in 54 and 55, his dad was one of my coaches. So while he didn't remember me specifically from them, he knew what I did through the years. So these are what friends are for, and this is why people help other people do things in life and put programs together. Years ago, Dr. Sheldon asked me to be on his radio show with Dr. Petra Snyder when he had his own radio show with over at Bright House. And I talked about Alzheimer's all the time. The years go by, I asked Lee to be one of the founding directors of this organization, which he did for a couple of years. And he's still on the radio show, the television shows, but he still has a column in our newsletter. And the reason for that is because I value what he says, what he brings to the equation. Dental care is dental care. There is good dental care, there's average dental care, and there's dental care that people have to do because it just must be done. But there's also an aspect of dental care that is important. And it's important that more people realize the seriousness of treating infections and disease and poor conditions in our mouth. And that's when I've talked to people over the years, I said, well, why do you have a dentist on your show a lot, Joe? I say, because more people need to understand, and you yourself, and working on an international basis, Lee, now with periodontists across the world, you're realizing that there's a lot more that periodontists can bring to the dental care equation than we have in the past.
Yeah, actually, we're trying to get patients to realize that because patients need to have good diagnosis done and good treatment planning done, and it's the periodontist who's trained to do that. But if you're not referred to a periodontist, how do you know you should be going to one? And the group that we have, which is the American Association of Independent Periodontists, essentially is a group that is there to educate patients that you can and should see a periodontist first if you have periodontal disease or if you have complex dental needs. By doing that, we can make an appropriate diagnosis, we can do an appropriate treatment plan, and save you an awful lot of money. At the same time, create a very predictable, long-lasting result.
Yeah. Dr. Sheldon, your specialty is implants, and you've done implants on me. I know how you do them. You explained exactly how you did them. You showed me the equipment you use. Your equipment is state-of-the-art. It's something that most dentists don't have. Right. I know that. But I also, folks, ask Lee at times to talk about what I call touchy areas. And one of the most touchy areas, I think, in the dental care equation has to get in with what we call affordable insurance. It goes into affordable care. It covers what a hospital will do, what a hospital won't do in emergency care. And this is where the mouth differs from any other part of the body, Lee. If somebody's got a foot problem or an arm problem, a wrist problem, a finger problem, a chest problem, a head problem, you go to the emergency room, right?
That's correct.
What happens if you got a condition in your mouth that you don't have the money to pay for it? And, there's only so many ways to get charitable care. And, folks, if you want to start talking about charitable care, you're not going to find anybody that's got a better understanding than I do of it, because I've been dealing in this area for 25 years. And because of people like Dr. Sheldon, other doctors I know, I've just never, ever had anybody turn me down from helping somebody.
That's right.
And that's important. And I think that's the part of the care equation that needs to be brought out morally so that people know about it. I asked you a question for the show. I said, if somebody has a dental problem and most people don't have dental insurance. And if you have dental insurance, I'm finding out now that it covers very little. It's almost Mox Nix, doesn't mean a damn thing.
Right.
But what did you tell me if a person has got such a foul mouth that they got problems and they need to be fixed? What can they do?
Well, if you have a very bad mouth and you have very little money, a dentist can at least dissect down what needs to be treated now and what can wait. Example, if you have a tooth that's causing infections in your jawbone, that could become a life-threatening issue. But just because you have rotten teeth does not necessarily mean that every one of those teeth is causing an infection right now. So if you have a problem and your entire mouth looks bad and you just can't afford to treat the entire mouth and have the surgery done to extract all of the teeth, a good dentist can look at the area that is bothering you the most, or the area that is swollen, or the area that's infected, and just treat that area at a lower cost rather than treat the entire mouth. So that just because you have a problem, you say, "Oh, my whole mouth just needs to go." First of all, there are a lot of patients who come into me and say, "My whole mouth has to go, all my teeth have to go," and that's not true at all. You kind of look at it and say, "Oh, nobody could do anything with this." Well, we save an awful lot of teeth where people feel they might not be able to. But if we just look just at that isolated problem of infection, that one isolated problem of infection can be treated, and we can be treated for a few $100s rather than thousands of dollars. So don't give up. Just see a dentist, see a surgeon, see someone who can help you. And we have emergency clinics all over Brevard County. We have one in South Brevard. We have one in Central Brevard. I don't know if we have one in Titusville or not. And you can go to an emergency clinic and for a very reasonable fee get the emergency taken care of.
And if a person needs treatment and a dentist that looks at you knows and it's within their realm of being able to accomplish, I would say that most dentists, if you approach them the right way and say, "I can afford to do this, can you do that?" And you never know what can be accomplished unless you make you start a dialogue.
I can't turn down an infection. You can't. And so if you see an infection and you say, all right, it's going to cost $500 to treat that infection. Let's say that. And the person came to me and said, "Listen, I can afford $100 a month. Can you treat the infection for $100 a month?" And what I would say to that person is this: yes, but don't make me bill you for it. We're going to do this on a gentleman's agreement or a gentleman and ladies agreement. Here's 5 stubs. Mail this in to me or drop it off to me once a month, and we'll be fine.
So what we're talking about, folks, is that almost anything that you set out in your life to do, if you go about it the right way, you can have generally some measure of success. But if you expect, demand, and say it's got to happen, it just may not happen that way.
That's correct.
And
understand that all of us took responsibility when we got teeth to begin with to make sure that the teeth were maintained and were maintained properly. Okay, we lost that responsibility in some way. We ate too much sugar. We did something that got us to that point. All right, so now we're in dire straits. There still is a way out. It's just a matter of working with the practitioner that you're working with, and you can get it worked out.
Yep. So the old adage, "Nothing ventured, nothing gained," certainly can apply in the field of medicine, because sure. I know that it's just like, people have absolutely nothing, go to a hospital and you end up with a $300,000 heart operation.
It's true, and it's a $300,000 heart operation. The difference is the $300,000 heart operation you're not paying a dime for.
Yeah.
When you go to the dental office, there is no such thing as $300,000 worth of reimbursement. There's usually not much reimbursement at all, and so you are dealing directly with the dentist. And of course, the dentist, in order to be able to have the equipment that he has, or he or she has, and the nice assistants and everything, that costs us money as well. We don't have any government agency that we can apply to for reimbursement. We don't get Medicare reimbursement. We don't get that. And so that our bills have to be paid too.
Well, I personally think, having known you for the many years that I've lived here in Brevard County since I retired from the Navy, Lee, that I've learned more about dentistry and what dentists can do from you and a guy named Mason.
Yeah.
And you know Dr. Mason.
Yes.
You know who I'm talking about.
Yes, I do.
Yeah. And I know he happens to think quite highly of you and your work, and you have said the same thing about
That's
that
right.
man.
He's did a nice job on you.
So it's information, education. And that's why we started this radio show, this television show.
And that's why, by the way, that's why I wrote my book. You know, Matthew and I wrote 2 books to be able to allow dentistry to really be understood by the layperson. There is not one dental term in there that has been put in there so that you can't understand it. We had it reviewed by 2 editors to make sure that it was totally in patient-friendly language. And so that if you have a problem, all you do is go through the index or you go through the table of contents. That problem, that dental problem will be there. You can read 2 pages about what that problem is all about and then understand what the solution is to that problem.
What Lee's talking about, folks, he wrote a book called The Ultimate Mouth Manual a couple of years ago. And then he followed it up with a revised one. It's about 1.5 times as thick as the first one. Incorporated a lot of the first book with updated stuff into it, and he added more stuff to it. I was getting ready to do a show on another topic, and I was in my office at the house, and I opened up the second edition of the Ultimate Mouth Manual, and I got some information out of there for another radio show I was going to do, but. How many of you would believe me if I said it's actually interesting to read the book? It really is. And I'm not just saying that to butter up Dr. Sheldon, who's sitting across from me in this radio station today. It's an interesting read. And for all of you that reads the detective thrillers and the history things, there's a lot of history contained in what medical conditions have transpired and how they've been fixed in our country. And I think probably one of the most misunderstood medical topics involves dentistry.
I think so. Nobody really understands their mouth very well. Yeah. It's a hidden area. You can't look at it. You can't see it. I think some of the things that we've been able to do with technology to be able to take an x-ray and magnify it to the point where you can see it on a big television screen allows you to be able to understand things a little bit better, but still it's a hidden area. But most medicine is a hidden area as well. We think that we need to have some upper level of understanding in order to be able to understand it. And frankly, a good physician can put it in patient-friendly language so that you can understand the parameters by which you make that decision, and dentists can do the same thing.
And I think that more people, whether it be going to a dentist or a medical doctor, should be more aware of our own individual need to have the doctor explain conditions to us so that we can have a better understanding of what additional treatments might be involved.
Oh, it's true. And there are a number of patient-centered health newsletters. Harvard does a newsletter. I do a newsletter. I do a monthly. We have the Solid Bite newsletter, but we also have the Julian Whitaker newsletter, which is my favorite. There are a number of different newsletters that are out there that in 8 pages a month, you can get a real good handle on your health care because these newsletters are written for patients, not for doctors.
Well, I'm going to ask you this because I'll forget it. I want to wait till after the show. I was talking to Kay, our information specialist, before the show in the car as I was driving up, and she said, would you ask Dr. Sheldon to give us a little more information about the second Ultimate Mouth Manual so we can put it in our newsletter? She has an area she wants to put a little bit about your book in. So she probably wants about 150 words.
I can do 150 words in 20 minutes, as you know. So I'll be happy to.
All you got to do is send it over to Kay because she wants that. And Kay's listening to the show. So, Kay, I did what you asked me to do. I asked him to do it, and all these people are listening, so now he will do it. So, but, Lee, we were talking about dental implants, and actually we're talking about dentures. What's a general statement you might be able to make as a periodontist about the fit of a denture and what people should think about regarding action to take if they don't think their dentures fit right?
Well, first of all, I would not depend on you, patient, to understand whether the denture is fitting right, and I'll tell you why. When you had that denture made or that partial denture made 5, 10, 15 years ago or longer, and you've been sitting there wearing the same partial denture with no adjustments, nothing made. Let's talk about what's occurred during that time, in that 5, 10, or 15 years. Your gums have changed. Your bone has changed. The teeth are made of acrylic and they've worn out. The denture may be rocking as a result of that, and frankly, your denture teeth may not even be touching your natural teeth anymore. How do I know that? Because most of the partial dentures that I see exactly fill that bill. You know, the mouth changes, and frankly, these materials are materials that are made out of acrylic. These aren't hard steel materials. These are acrylic teeth, and they do wear out. So I think if the partial denture isn't supporting, or the denture isn't supporting properly, it means that it's putting too much pressure on something else. If it's a full denture, it's putting too much pressure on one part of the mouth. And Stickum is not going to help that. It's still going to continue to apply pressure to the mouth, which is going to cause destruction or premature destruction of the bone. And if you're using a partial denture, it's going to place too much pressure on the natural teeth, and it isn't doing the job that it's made to do. There were estimates done, these were studies that were done, microscopic studies that were done years ago, that shows that the average denture, the average partial denture, gets out of alignment within 1.5 years of the time that it's made. And so that means we need to see our dentist in order to be able to make sure that the dentures are relined to compensate for the changes that have occurred in those tissues. Important to look at that. Important for the dentist to follow that up and see whether the teeth are actually doing what they're supposed to do.
Can that be done without making a whole new plate?
Yes, it can. You can. You can actually add acrylic to the existing plate. It's a one-day turnaround. You essentially make an impression, send it out to the lab. The lab relines the denture, adds new acrylic to the denture, and you get it at the end of the day. Patients will usually come into our office between 8 or 9 o'clock in the morning, and by 4 o'clock they have the relined denture in their mouths.
But Lee, there must be something that would be an indicator to a person that they would need to go ask their dentist about their dentures.
Yeah.
What are some of the things that would cause a person to think they might have a problem?
Well, if you have soreness in your teeth, that would be one thing. If there's soreness in the teeth around the denture, then you do have a problem. Because the denture isn't fitting anymore. If you're wearing a partial denture, one way to test the partial denture and see whether you're biting on it properly or whether the teeth are meeting is just take a piece of paper. Take a small piece of paper, something that may be 1/2 inch wide or maybe 3 inches long. Put the piece of paper in your mouth between the teeth and try to bite down on the paper. If you can slide that paper out, it means those teeth aren't contacting. Very simple thing to do. We call it the load test, and that's a chapter in the Ultimate Mouth Manual. The load test, it describes that in detail. And all you have to do to get that is contact our office, 259-9980. We'll be happy to mail a copy of the book out to you, or go on the web, www.drleesheldon.com, and you can download the book right from the website.
Well, let a non-medical person ask you a question about a medical thing.
Okay.
If a person puts that piece of paper through there and they can pull that paper through there and their dentures aren't aligning correctly, how many times have you had somebody come in, have you asked them a question, are you experiencing headaches? Doesn't misalignment of the jaw reflect a pressure on the jaw hinge, which radiates into causing headaches?
Absolutely.
We've talked about that on a radio show many times over the years.
Yeah.
But these are related conditions that, it goes back again to information. If somebody listened to us talk about this on the radio show today, it gives them a reason to ask a question. But if you don't know anything about any of this stuff that we're talking about, how do you know to ask a question?
No, you have to read. But that's whether we're talking about a roof, whether we're talking about plumbing, whether we're talking about dentures, we're talking about overall health care. We can take some responsibility. There are enough patient-friendly publications out there so that you can become educated and you know what questions to ask.
Okay. So, folks, we're talking about education and information. Hometown News hits the street tomorrow, and there is an extremely well-written article in Hometown News. I didn't write it, but it's written by one of the staff writers, and it's about the auction for helping seniors over at Holy Name of Jesus Catholic Church next Saturday. That's the 17th of October. Read about it in Hometown News. Don't just take my word for it. The staff writers asked several people questions. I've seen some of the pictures of some of the stuff that we will offer. It's priced right. It's priced for what the market will bear, and but you're helping a good cause.
And you can make the market bear a little bit more, by the way.
Yeah.
Just up that bit a little bit.
Thank you, Dr. Sheldon. And I want to thank you, listener, for listening. I will see you next Thursday, couple days before the show. And thank you, Dr. Sheldon, for being with me today. And I hope that you all have learned something about the practice of dentistry that can help you help yourself. See you next week.